in small text, I will summarize the condition here in Gaza. Yeah, okay, yes. My name is Ahmed Muhanna. I am director and manager of Awda Hospital in northern area. Also, I am supervising Awda Hospital in the middle camp. We have 2 hospitals. And this is the largest facility of Awda Health and Community Association. Actually, we are working in emergency since long time because our hospital here in the most marginalized area in northern area in Sector Gaza since 1997. And we passed our experience through many attacks of Israeli attacks past 2004, 2008, 2012, and 14, 2021, and last one, this one, the most aggressive one. So last Saturday, 7th of October, I came early to the hospital at 6 o'clock morning, and I start activate the emergency plan in the hospitals, and I called all the colleagues, the head of departments, and I organized meeting urgently for discussion about the situation and suspected situation which will be in Sector Gaza. And accordingly, we start activate plan C. This is the most critical emergency plan in Awda Hospital. And we stopped all our elective surgeries and stopped our clinics, outpatient clinics, evacuate the hospital from regular normal patients, and we kept only serious patients. It means 80 beds, we evacuate about 72 beds, and we remain just 8 patients. Anyhow, we started the load, the strikes and the bombs and the attacks started at evening time, and we start receiving injured patients from northern area, and in the Nusayrat starting receiving injured from the middle area. But what's the difference in this war? The aggression of bombs, I see the aggression of the attacks and the kinds of bombs what's using in this attack. It's terrible, and the houses destructed completely, 4, 5 floors or 10 floors on the civilians, ladies, women, babies, and childs, and others. And why I'm speaking, because all the patients who received in Awda Hospital, civilians, all the patients, civilians, and the majority of these civilians, baby, is from childs and women's. And I start a plan with the Indonesian hospital in northern area. It's a governmental hospital, and we work together through emergency community reflected to the Minister of Health, and we start sharing the cases. For example, they are most overcrowded. I can take 10 patients or 20 patients in my hospital to evacuate the governmental hospital, and so on. But now it's 11 days after attacks. Now we are feeling we have a problems in the hospitals. Really, we have developed these problems because our strategic stock from the medications and disposables, it's limited. It's for 1 month, for example, in the regular war. But in the attacks, in the war situation, attack situation, it's increasing a lot the consumption of medications and disposables and consumables. So now we have lack and we have shortage in some of consumables. This is not the greatest problem, what I am meeting now in the hospital. The greatest problem is a shortage in the fuel. This is the major problem what I am meeting. And oxygen. I have just 30 cylinders in the hospital. 30 cylinders full and 120 empty in the hospital. So it means the oxygen and the fuel enough 4 days maximum to run activities of the hospital. And now, I don't know, we are shut down the generator some 2 hours morning and 2 hours afternoon, but it's not enough. It's consuming a lot, 50 liters per 1 hour. It's 380 kVA. It's a huge generator. Today, we received 1,000 liter of fuel, 1,000, which means it's enough for us 1.5 day, 1.5 day. So I called all the distributors of solar, and no one responding to me. No one. There is no solar or benzene in Gaza. Or yes, but it's accumulated for some who. I don't know. Now without electricity, I couldn't continue my activities, and I'm living now a big problem. And on other hand, the big problem that I received a call from the Israeli side that they asked me to evacuate the hospital within 2 hours. I refused the request, and I told even 24 hours not enough to evacuate the hospital from the personnel and patients and equipments. It's impossible. But he insists to evacuate at max. Give me the period 10 o'clock morning next day. I afraid on my patients, and I worry about my patients. I evacuate 6 patients, critical patients, to other hospital, and I kept my other simple and easy patient and obstetrics in the hospital. But next day, with my team, after consultation with the team, we decided that we will stay in the hospital. We will not leave. And now it's 4th day after calling. We are here, and I expand the services in the hospital, and we are here, and we decided to stay, and we will be here. Even if they are calling every day, we will not leave the hospital because we have one reason. We have hundreds, thousands, 11,000 of injured. And the capacity of the hospitals limited, so much limited. And it's incompatible with the huge number of injured. So if we will, and they call 5 hospitals. If we will leave the hospitals, the people will die in the streets. It's not allowed. It's not humanity. We cannot say, we cannot accept that as a human being and as a doctors. So this is our condition, and even in the governmental hospitals, in the Ministry of Health, they are collapsed. The system whole is collapsed. In Shifa Hospital, the biggest hospital, contains 600 beds. This hospital now is overcrowded. They are operating in the corridors. It's amazing. The staff initiative, and doesn't leave the hospital. All staff. We are here in Awda. We are staying here. We are not leaving. I am 11 days not. I'm not leave the hospital. Yes, I want to say for Belgium. Belgium they supported us very well in the 2018. I called appeal for Belgium organizations, and MSF Belgium, they responding, and they sent a team, surgeons. They assist us and they help us, and they organized here in Awda a department for limb reconstructive surgery, and this unit saved a lot of limbs of guys. And they are left Gaza because the situation is dangerous. I can understand, but the department still here, and we are expanded more patients in their department, and I call the staff who is working in this department. So I'm glad, I'm thanks for Belgium, but also I'm looking for some from government, yeah, just to say for Israel, stop killing children, stop killing civilians, stop killing